Welcome to Mom and Mind. I'm perinatal psychologist and host Dr. Kat. There is more to the story than just postpartum depression, and this podcast aims to share it all, from personal stories and lived experience to experts who break down the ups and downs of life, from getting pregnant, pregnancy, perinatal loss, and postpartum adjustment to new parenthood. While this is not psychotherapy or medical advice, it is all of the stuff you ever wanted to know about mental health and new parenthood. Welcome back to Mom and Mind. I am your host, Dr. Kat. In our episode today, we are talking with Dr. Dorianna Alfred. She is a licensed psychologist in the state of Ohio and certified in perinatal mental health. She's the owner of Works of Faith Wellness and Consultation in Columbus, Ohio. This is a private practice centered on perinatal mental health services. She provides individual therapy, workshops, and continuing education that promote health equity for those at the highest risk for complications during pregnancy and postpartum. She has co-authored various publications and refereed workshops on topics related to women's health, racial identity, social justice, and cultural competence. She is also the author of a book, Pregnant with Promise, A Spiritual Journey of Pregnancy, Bed Rest, and Childbirth, a memoir of her journey with loss and pregnancy complications. And that is what we're going to be talking a lot about today, some of her personal journey through her loss. She also talks about the effects of the pandemic that she's seen on clients who she works with, and very specifically, how difficult and stressful it has been for Black women dealing with birth and the fear of loss. Another thing she touches on that I think is really, really important is that it's really very different to feel something in your own body versus be able to label it as trauma or some diagnosis of some kind. Oftentimes people's lived experiences are very different, or it may be hard to connect it to any specific kind of diagnosis, because we are very complex, and we're more complex than what a diagnosis or diagnostic criteria can fulfill. So I'm really excited to have you hear from Dr. Alfred, and you can get connected with Dr. Alfred at worksoffaith.net, on Instagram at Dorianna Alfred, and find her book, Pregnant with Promise, on Amazon. So let's get started and meet Dr. Alfred. Welcome, Dorianna. Thank you so much for being with us.
Thank you. Thank you for having me.
I'm very excited to talk with you today and to learn about your work and the book you've written and all that you're doing in the field of perinatal mental health. So please do start off wherever you'd like on how you got into this specialty.
Yes, I'd like to say I kind of fell into it, but it seems like those of us in the field kind of naturally get there, and sometimes as part of our own personal experiences. And so I would certainly say that that has also been the case for me. I had a history of an early pregnancy loss, the first trimester, and at that point, really did not came to understand that pregnancy loss in the early trimester is, approximately 1 in 4. And so, just kind of took it in stride as, this is something that happens. And then years later became pregnant again, really did not give much thought to that earlier experience and that, it might have any impact on the current pregnancy at the time. Mm-hmm. And eventually, kind of get through the first trimester, and at least in my mind at that point felt like, okay, we're safe, kind of gotten out of that first trimester. And then in the second trimester, we were between 19 and 20 weeks and had a pregnancy loss at that time. And very, very traumatic for me, really difficult. I just recall initially learning that, I wasn't going to be able to carry the baby to term. And so I thought, well, okay, when I had the first pregnancy loss, like, okay, this is kind of what they'll do. I'd gone through a D&C procedure before, but they told me that that wasn't possible because of how far along I was and that I would have to deliver. And that was very upsetting and devastating for me. And so I get through that process and really didn't understand how that was impacting me, impacting my relationship with my spouse, and also did not recognize the level of anxiety that I started to experience. And it wasn't until I became pregnant the following year again that I really realized the extent of my anxiety
Mhm.
and still not quite yet understanding the trauma that occurred from the birth with the previous pregnancy, but kind of went into this next pregnancy worried
Sure.
about whether or not the pregnancy would continue. And thankfully came through that pregnancy with a live birth, my older son, which was really exciting. But boy, I'll tell you, that whole pregnancy was another form of trauma in some ways,
Mhm.
in the sense that I was on bed rest for most of the pregnancy.
Mm.
And at about 20 weeks, kind of symbolically of that last pregnancy, went to a routine appointment and was told that I would have to be on hospital bed rest.
Oh.
So I was on hospital bed rest for 14 weeks.
Mhm. Yeah.
And yes, there's something about living in the
Mhm.
hospital
Mhm.
for 14 weeks that was really difficult to explain. But I wrote a memoir, and you referenced the book earlier. And the book is really compiled of my journal entries, actually, that began from the previous pregnancy up through my last two pregnancies. And
Mm.
so it talks about some of the challenges that I had. And, the interesting thing about writing that book is it was very difficult. It took me years to
Mm.
actually publish the book because it was so painful and I had to
Yeah.
relive as I would edit and look at it. It was
Mhm.
really challenging. But also, what came from that experience and the experience of birthing our two sons was that so much had happened to me emotionally and psychologically that I thought, people shouldn't have to feel this way.
Right.
And so I really decided at some point, not right away, I really did not, it took me years,
Mm.
again, to even get to a place where I was looking kind of at, well, what's happening with other mothers? And I
Right.
think in part because I had been so traumatized and I
Mhm.
needed space and I had quote unquote survived. So I
Mhm.
needed to focus on the little ones. And
Mhm.
I did that and grateful and thankful for that part of the process. But I, then came to realize like, wow, like this is still happening. Like people are still
Mhm.
struggling and this is a really big deal. And so then I began to shift my attention to perinatal mental health. I'm really
Mhm.
just within the last few years in a professional capacity. I have the
Mhm.
lived experience for many years, but
All
the
right.
professional part for just the past several years.
So you were already a psychologist in the working in the field as you were going through the losses and then the pregnancies.
Oh, yes. I was actually in an academic position when I
Mhm.
had the first loss, and we were in Georgia. And kind of part of our story is that my spouse was in the military. So
Mhm. Mhm.
we were moving about in between the different pregnancies and relocating. And
Mhm.
it was all quite interesting, but, we're grateful to have gotten through that process. But yes, I've been, in the field many years, 2004,
Mhm.
2006 license. So yeah, in the field quite a while before I came to
Yeah.
this.
Right. And just out of curiosity, I guess sort of partly personally, but also because I hear it so often, did you get any kind of training on any kind of perinatal mental health stuff during grad school or residency or internships or anything?
No, I'm sorry. I chuckle because I thought if only I had.
Right. Same.
I probably would have understood my experience much better. And I
Mhm.
probably would have, been more effective in working with,
Mm.
birthers and not just, kind of assuming like, oh, yeah, I've worked
Mhm.
with people who are pregnant all the time. And it's like, yeah, but are we doing a good job? Like, are there things that we need
Right.
to, be aware of and mindful? And it has been so eye-opening to
Right.
learn that, like, wow, this is a whole thing. It's a
Mhm.
discipline. Like, there are things that guide the practice that are very important and
Mhm.
essential for people to know about. So I did not get any training, but
Mhm.
have since then been making up for it.
Right. Right. Yeah, I think it's just such a shame and a loss that this isn't covered, in any kind of training, and, hopefully someday that
No.
will change, but I don't know. I just think sometimes of how much just the landscape of mental health in general would change if everyone were trained in perinatal mental health, because this is where the next generation's mental health also starts. Um,
Absolutely.
mm, anyways,
I would
yeah.
agree. And
Hmm.
even thinking about like, talking about birth trauma,
Hmm.
of course, well versed and can tell you about the criteria for PTSD.
Right.
But when I had the experience from a birth perspective,
Mm,
I did not match it up.
right.
Like I didn't line up what
Right.
my experience was with trauma or what I had experienced. And so I think, as a psychologist, that's kind of an odd thing to say, which is,
Mhm.
like, hey, how do you not recognize that? But I think it goes to, just goes to say that you can have book knowledge and professional knowledge about things. And when you're
Mhm.
in a place, sometimes a very vulnerable place of, being pregnant and trying to understand and care for your own body and baby,
Mhm.
things may not line up the same way.
Right.
You don't recognize always, oh, that was anxiety and like,
Mhm.
oh, that's depression.
Oh, right.
Things that, any other time we'd be very well versed on and easily, be able to discern in other people may be more challenging for us to see sometimes in ourselves.
It is. It really is. Yeah. I thank goodness for other therapists, um,
Indeed.
us to go into our own, I go to my own therapist, and I just think
Yes,
we do need that outside perspective,
we
because I
do.
think we are, um, I don't know if this was your experience, but for me, in my experience, I felt very much like, well, I'm a psychologist. I should be able to handle whatever this is. So even
Yes.
though I knew I didn't feel right totally, well, at all, it felt like I should try to feel right and kind of
Yes.
be be just in myself about it. But apparently we need help too.
Indeed. And yeah, it's so interesting too that you say that because I think the people around me, like even my providers,
Hmm.
thought, oh, well, she's a psychologist. She's
Right.
probably okay. And
Right.
then I was thinking, especially, all the weeks that I was in the hospital,
Hmm.
they'd come in and come out. And I think once that I can recall, I'm going to give the benefit of the doubt and say maybe a couple of times, did I have a social worker come in and speak with me
Mm.
for 14 weeks?
That's
That's
a long time.
it. And
Hmm.
it's like, wow, people, I was not in a great place all the
Right.
time.
Yeah.
Just I think on some level, I seemed quote unquote maybe like I had it together and they knew I was a psychologist. And so
Hmm.
maybe assumed I had kind of my own
Hmm.
strategies and skills for managing that.
Hmm.
But it was very challenging because I had come from the place of a previous pregnancy loss, then kind of an impending one, which, from what, at least from medically, what they said.
Hmm.
So it was a very difficult time emotionally
Right.
for
Yeah.
that.
I'm glad you kind of pointed that part out. How there are social workers, there are people in the hospital who can kind of attend to these things, but it's still, even with that, I think it's too little.
Right.
We're really, really lacking in focusing on how these stressful events impact people. So yeah, there's
Absolutely.
a lot of change needs to happen.
Yes, for
Mhm.
sure.
So yeah, so I just find it very inspiring that you were able to all through all of that journal and like take all your own notes for yourself. I don't know if you knew it would be a book or not, but I can't imagine how hard it is to go back through there and put it all together into some readable form. So thank you for doing that and for everybody who can feel heard and seen through your experience.
Yes, I appreciate that. It was quite a vulnerable experience to kind of because these are I did not think this was going to be a book, and they
Mm.
were my literal innermost thoughts, like my literal journals. And, it was hard to release that to whomever would buy a copy of the book, people who knew me, people who didn't know me. And, yeah, and, to talk about really difficult things. And one thing I will mention, I thought it was interesting and felt so much appreciation. You had a guest not too long ago talking about coping with fetal diagnoses
Mm, mhm.
and with the 20th, the stillbirth that we had, our son Joshua, he had an umbilical,
Oh,
which the first time I had ever heard anybody talk about it outside of the context that we knew it was on your podcast.
wow.
And I thought, wow, how, amazing that somebody, I don't know her personally, but I was
Oh,
like,
sure.
oh my gosh, somebody knew the experience. And so it is, I think, a good opportunity to appreciate, the opportunity to share my experience with other people, and
Yeah.
certainly appreciate platforms like this to allow that sharing to occur.
Oh,
So I
I'm
never heard anybody talk about that. So I just had to make note of
yeah.
that.
Well, I'm glad you're saying that, and that was the first time that anyone had talked about it here
Mm,
on this podcast, and we've been going for almost 5 years. Not saying that none of the other guests had ever dealt with anything like that, but I do think there's just a different level of vulnerability, and with fetal diagnosis, and I appreciate you sharing that as well here because honestly, and you know this, I'm sure very well, that the more you hear similar things or the
yes.
same thing, the more normalized it becomes, the less stigmatized it becomes.
Yes.
Mhm. And especially with
Absolutely.
loss. So I especially appreciate you sharing your experience.
Yeah.
And I'm sure it has informed you professionally in so many ways. And these are the folks that you're supporting now.
Oh, absolutely. And, it's amazing to hear people talk about their experiences of loss, even in practice now. And I have a private practice. And, even the way that we, assess and look for that information, sometimes people don't put it out there until
Mhm.
you ask.
Right, right.
And then you find and you learn that, yeah, there have been, multiple pregnancies, but there may be, a couple of live births. And so being able to give space for people to talk about their losses, and even looking at how those losses may impact pregnancy after loss
Sure.
and parenting, along the way. Very interesting, experiences hearing that, and some of which I can share in, of course, because of my own experience.
Mhm.
So really looking at, I think, especially anxiety. I think a lot of times people will hone in on after loss depression, and
Mhm.
certainly relating to like, oh yeah, someone who has a loss would certainly have a lot of grief, and
Mhm.
some depression would be understandable. But the anxiety piece, I think, is what people don't focus in as much on, and it's also very prevalent.
Yeah. Yeah, you're absolutely right. Is that what you're seeing a lot more of these days?
Yes, I think not just for people who've experienced loss, but certainly I'm seeing it from that standpoint. But I think with the pandemic and just where we are in the, our journey in this country with social injustice and racism, there absolutely, I am seeing clinically more anxiety, and not just generalized anxiety, the nervousness, difficulty relaxing,
Mhm.
excessive worry kind of thing, but social anxiety, which makes a lot of sense given the fact
Mhm.
that we have been in for the pandemic, various states of being in with, different orders and that sort of thing. Our children are being in, families are
Right.
working from home, so they're in. And so going out
Mhm.
after you've been in, so, to varying degrees, really is creating anxiety for people who I think otherwise didn't even have like even general anxiety
Mhm.
before.
Mhm.
So that's, I think, something new. And then people, I think sometimes it's hard for people to realize panic when they experience it anyway. But I also am seeing, in addition to the social anxiety, of course, there being more panic symptoms and people, feeling symptoms they've not felt before and not understanding them and wanting, feeling like they need to seek medical attention. And so, doing education around, what is a panic attack? What does it look like? What does it feel like in your body? Doing a lot more of that kind of education. So that I am definitely seeing an increase in practice, as well as just grief and loss, not even from, infant or pregnancy loss, but really just the loss of connection for
Oh,
people,
yeah. Yeah.
going through the pandemic, not being able to connect with family. not being able to share pregnancies the same way and, having those celebrations, showers, and all that sort of thing. So it really, I think there's this complicated or complex grief that I am also seeing quite a bit in practice. And as well as what I would say, I don't know if it's that there is this increase in what people are experiencing as trauma so much as maybe there's a greater awareness of it. And, that's coming from even, race related trauma and stressors and, other forms. But I would say in my clients, I'm definitely seeing a lot more trauma from perceived racism.
Yeah, I would love to hear more about what you're seeing and hearing in terms of the mental health impacts of all that's I mean, of course, there's a lot going on, so you can't really hone in on any one thing
Yes.
that's happening, but in terms of the injustices and, things being also so visible, like very much in the
Yes.
public eye and how what you've seen in terms of how that's impacting perinatal folks.
Yes, for sure. What I am noticing is, especially for those individuals who may still be in the workplace, meaning going into buildings other than their homes, is this difficulty kind of entering that space, and I think the uncertainty that comes with, like, where do people stand? So,
Mm-hmm.
for example, if I'm working from home and something happens, there is, an incident that has happened, then if I am in my home, I connect, with whomever I feel like I need to connect with around that. I'm, seeking support. I'm talking on the phone with people that may help me to kind of work through, in some ways what has felt like the next thing, the next death, the next life that has been lost, the next protest. There's, again, like you said, there's just been so much. And so, sometimes going physically into a workplace, especially, depending on the environment, there can be this sense of, does it feel safe? And how safe is it being in this environment? Are people going to even acknowledge it? Which I think is a big thing. Like, you can have this experience of, going into an environment and almost being like, okay, it's another day at the office, so to speak. And, for those who are impacted, regardless of, your race, gender, regardless of all that, we can all be impacted by everything that we've seen. And so going into these spaces, is there acknowledgement? And sometimes what I'm hearing is there is not. The lack of acknowledgement of what is happening in the world and in our communities.
Right.
So, it may not be, something that seems very far away. It could be something that's happening in your own community. And, that lack of acknowledgement adds another layer of stress. And I think, certainly for someone who is pregnant or postpartum, you think about those added stressors and, just how do you manage that? And one other thing that I've noticed is, for those who are pregnant and, especially I've noticed this with African American women and birthers, you hear and you have heard, like, especially within the past year of, what's happening with Black maternal health. And, there's lots of different ways that people talk about it. But to be a Black birther right now, in the midst of a pandemic and in the midst of all of the information that's out there, in some ways can be helpful, but imagine how overwhelming that also is.
Right.
That I am one of those people, who all these statistics are about. And as I'm preparing for birth, not me personally, but, for someone preparing to give birth, that's a scary thing to think. Am I going to be okay? Am I going to survive this? And so in a lot of ways that can, I think, definitely has added to the stress that many birthers, especially birthers of color, are feeling right now. And I think that's just notable, something that has to be understood and also held.
Right. Right. And as you were talking about it, I'm thinking like there's a conscientiousness about, like you were saying, the statistics and having all these facts and figures. So there's, the part of awareness that's just like front and center. These numbers, and
Yeah.
that is, scary. And
Mm.
also there's just like a feeling in the air too. There's a tenseness. There's like a very
Yes.
visceral feeling of just, how things have been here, specifically speaking in the US, but I'm sure other
Yes.
places too. But in terms of just racial tension and like you said,
Mm-hmm.
not knowing if like the provider you're going to have is going to give you adequate treatment or, even for some people believe them when they're talking about their
Yes.
experience. So it feels like very on a conscious level and just kind of all around you and not an unconscious level, but just ways that you might not be able to put into words.
Absolutely. And so yeah, when you put yourself in the minds of, someone who's pregnant at this point, whether they're, a person of color or not, it still is like there's just so much that's
Mhm.
there. But especially I think for Black birthers, there really just is so much that you are, I think, contending with on top of
Mm.
whatever else you kind of have going on in your life.
You sure?
It's just this extra layer of things. And so, one of the things that, is, I think I found helpful is just giving space for clients to be able to talk about that and
Yeah.
to release those, the emotions that can be really pent up
Mm.
and, to talk about, what sort of things can you, put in place and, just kind of trusting the experience because yes, there are the numbers, there are statistics, and each one of those numbers, that's somebody's mother, that's
Mhm.
somebody's relative. So all of those numbers, they're not just numbers, they matter and they
Yeah.
count. And also really looking at each individual person that we touch as therapists or providers in terms of providing support and services. It's like how do we allow space for those conversations, encourage things that we know work, like having
Mm.
doulas. We know that that is effective in supporting outcomes for maternal health, especially Black maternal health. So, encouraging those things that we know work. Those, I think, are things that can really be helpful for birthers during this time period.
Mm. Yeah. So, really having adequate support. I'm just thinking back to during the pandemic when people weren't even sure if they could have their partner in the room, let alone, support and of anybody else. But now that things are, getting a little quote unquote better, it's more likely they could possibly be in the hospital birthing room. But even just if it's at
Yes.
home, having some kind of support from somebody who can guide and support you is very worthwhile.
Absolutely. I think honestly, there still are, I think, quite a few restrictions like on having doulas, but the really cool thing is I think many doulas have, started doing virtual
Yeah.
and being there whatever way they can. And I think I could not say enough about even having a postpartum doula. I
Hmm.
think there's a lot more discussion about the fourth trimester, and some people are even saying there's a fifth and a sixth. And
Hmm.
so I think, beyond all of those trimesters, it's really like there is so much more that continues to happen emotionally and psychologically and physically
Yeah.
beyond the birth. And, how are we providing support, putting things in place proactively? Because we do know that there can be so many challenges. And it's been really nice for me to have these experiences of being able to see people who are pregnant and then seeing them postpartum and then maybe pregnant again.
Hmm.
Because one of the things that I think also is beneficial is having people continuing to work on anxiety, depression, grief,
Yeah.
loss before they even start that
Right.
journey. if it happens to be kind of in between pregnancies, because, all of that work that people are doing, to develop skills and to process and kind of let go of things that have, burdened them, those things really can support, pregnancy and mental health and well-being for subsequent pregnancies and, for child rearing. And so that, is really exciting too, not just thinking about the fourth and fifth trimesters, so to speak, but also even, before you begin that process of conception and, really understanding, your experiences, what you need, especially, for people who've had, I don't want to seem like I'm harping on trauma, but who have had trauma and especially sexual trauma. And then you have birth and all of the ways that can be so intrusive. And so being able to, be in therapy and have that support and feel like you have resources, there's just another level of agency, I think, that can really occur when that happens. So I'm like promoting therapy throughout the lifespan. How about that?
Yes, I'll second that for sure. Yeah, absolutely. And I think, I know to your point earlier when you were talking about your personal story, and I'm also reflecting on my own, is that, sometimes we don't even know that we've had trauma, and we don't really know what it is, but maybe there's some, I think it's totally reasonable to want to avoid thinking about horrible things. And so I think, a lot of people, well, anyway, some people don't want to go to therapy. Like maybe they want the healing, but the talking through stuff is hard. And it's so hard to imagine that like getting the support of a therapist can relieve that and can help that. So I really appreciate you harping on it and and championing therapy, because I think the more that people hear how beneficial it can be and how nice it is to have that support through, pregnancy and subsequent pregnancies and getting that healing in. Yes, it's hard, but it also makes everything better in the long run.
Absolutely. And I think, even as we, have those conversations with clients, that it is going to be difficult going in, so that there are not these illusions of, well, I've been here, 4 weeks and I don't feel better.
Right.
It's like, I know it's a process, but, also it can be a really difficult process. But the nice thing is you don't travel that road alone. Like you're working with someone who can, hold that with you and walk with you and talk about different ways. And I think sometimes it's like amazing for people to realize I don't have to function like that. I've functioned in the past. Like, oh my gosh, there's this whole new way that I can be and this whole new way that I can function. And they didn't realize that. And so I think it's especially, amazing when a person who's been, pregnant or, just having a pregnancy, and they go through the process of therapy and they're working on things and they're talking and developing new skills and some, sometimes even being on medication. It's like, oh my gosh, like I never knew my life would be like this.
Right. And it's so hard to imagine when you're in the depths of something that you like, what better would feel like.
Yes.
Yeah. But because you see the transformation all the time, right? It's the best.
Exactly. Yes, I know. It's just kind of trusting the process.
Yeah, which is hard to do, especially if you've been, like you're saying, through traumatic things. It's a little bit hard to trust processes sometimes, but the healing process is pretty miraculous.
It is. It is.
And everyone's journey is so their own.
That's right. That's right. I will say one other quick thing, just about, just observations and trends and things that I'm seeing in practice is also a greater interest in therapy. Now I don't know, what's happening in your area, but certainly in our area, there seem to be more people needing services on wait lists and trying to get in and get appointments, then sometimes there are appointments available.
Yeah.
And so I think that that is telling that people either have had positive experiences and know that it's been effective and want to try it or want to come back to that, or either are really feeling like, okay, I need something different, and I think this could be the thing that helps. And so I think that's been something really important and positive, throughout this process. And I also, it's been, I think, certainly there have been challenges with it, but I think it's also been very empowering for people to see that I can live through and shift through a lot of different things and be able to see and identify like things that help them to get through, like their faith, or just, getting into different, social groups, even online, and having that support and accountability. And so it's been also, I think, really empowering and powerful to see that, even as I'm navigating and maybe utilizing therapy, or trying to get to the point that I can utilize therapy, that there are other things, other strengths and assets that I have that I can really capitalize on, and that have either already helped me get through something like, the bulk of this pandemic, or just even other things. And, as you mentioned, for parents who they weren't even able to have anybody come into the room, or maybe there was just one person, just the ways that other people have kind of stepped up, the people who could be in the room and the people that, are there. So it's been, really, I think, awesome to see some of these other changes and shifts as well, that in addition to some of the challenges.
Yeah, absolutely. I see that same trend here, and I'm hearing it from people all over, this drive to go to therapy. It's like, all right, pandemic,
Yeah.
fine. Fine, you win. Finally gonna like go get some support here. I think it's really, in some ways pushed us all to some new edges, or stress, and having to manage stuff that we've never had to manage before. This is new
Oh,
stuff.
for
And then
sure.
having a pandemic with a pregnancy, and oh gosh, that's a whole lot.
It is.
So yeah, I'm seeing an uptick for sure in people reaching out for support, which I'm so grateful for. That
Yes.
we have these avenues now, especially with virtual sessions and whatever
Yes.
else to make this happen. Because man, if we didn't have this technology, oh,
Oh my goodness.
yeah,
Oh,
it'd be really rough,
yeah.
really, really rough. Okay,
Yeah. So definitely some positive things there.
Yeah, I thank you for bringing that in, and I'm so appreciative of the uplifting of therapy in general. I mean, both you and I know how
Yeah.
helpful it is, and try and get everybody to do it. But sometimes I think just hearing, from people and professionals like you who see how transformative and supportive it can be, it might just give somebody out there that encouragement.
Yes,
And
I
to
would agree. I would agree.
I really appreciate so much all of the perspective and insight and depth that you're bringing for us today. And with the hope of therapy and all that, what are some things, and one thing that you'd like to leave with our listeners for today?
Yeah, I think just I would say trying to take a risk. I know in, thinking about therapy, and people talk about therapy, some people actually don't even know what therapy is. And so they're like, people talk about it all the time, but I don't really know what it is. And
Mhm.
you maybe go sit and talk to people and that sort of thing. And I'm not the type of person who likes to talk about myself. And so, just, for transparency's sake, you do talk about yourself in therapy, and it really is an opportunity. And it's an opportunity to grow. It is an opportunity to develop skills that may help you in your, just in your general coping, but also with your journey of parenting.
Mm.
And so, what I'd say is, to the extent that you feel like you can, take a risk, find a therapist that works well for you. It maybe has, I always like to encourage people to, check out your therapist. Like, if there's a website, check out the website, read what they're about, and find someone who you think will be a good fit for you. And then, take the risk, take the step to utilize something that has the potential to be very beneficial. It's not the end all be all. It may not work for everyone, but it is something that certainly can be very beneficial, especially for those who are pregnant and postpartum, for that extra support.
Fantastic. Yeah, thank you so much. And so we'll wrap up with that. I appreciate your time and for you giving us some of this really good information and perspective today. Thank you.
Thank you.
Thank you again, Dr. Alford, for being with us. If you guys would like to get connected with her, please go to worksoffaith.net or at Dorianna Alfred on Instagram. And be sure to check out her book, Pregnant with Promise. Thanks to all of you who are listening. I really appreciate if you can share this episode with anybody who you think could benefit from this kind of support and this resource. Thank you so much for being with us. Until next time. Thank you so much for joining us today. Please share this podcast. Together we can support moms and families so that no one has to deal with this alone. Come connect with us at momandmind.com.